Hello friends, today I am showing you few results of my recently operated ventral hernia cases. This is a umbilical hernia and patient had a history of this hernia for last 2-3 years, and sometimes he used to have pain. So we did a laparoscopic operation for him, IPOM plus, and his umbilicus you can see has got a good shape now. Okay, this is another case of a para umbilical hernia in a middle-aged lady, and she also underwent a laparoscopic operation, IPOM plus, and only the 3 small holes, and the problem is completely solved. Her umbilicus again has become a normal shaped umbilicus and the hernia has gone. Now this lady had a past history of tubectomy, and at the scar of tubectomy she developed this large hernia. She also had some ovarian cyst. Okay, so we had to remove those ovarian cysts also, and because of presence of pus we did not place mesh in that case. Okay, this is another case of a incisional hernia in which patient earlier had history of some gynecological surgery, and at the site of operation she developed hernia and she presented with obstruction. Bowel got stuck in this hernia. We did a IPOM plus operation laparoscopically, and her hernia has completely get cured. You can see that hernia has completely gone. Now only 3 small holes and the problem is solved. This lady, she had a large incisional hernia, past history of bariatric surgery, and for this hernia we did a open TAR operation, bilateral TAR, incisional mesh hernioplasty, and her this thing has completely improved. This patient had a post CABG large incisional hernia. Okay, and he was having a problem because of this and a lot of pain. Now we did a laparoscopic operation for him, and again IPOM plus, and placed a big size mesh, and his hernia has completely got cured. Okay, patient also had inguinal hernias, and those were also repaired at the same time. This is the same patient. Okay. Okay, the bulge has completely gone. Now this is again post CABG, 7th case, post CABG incisional hernia, and we did a IPOM plus operation laparoscopically, and his problem also got cured completely. This is after surgery, that bulge has gone and patient is very satisfied. Now this is a post open cholecystectomy large incisional hernia with a lot of muscle atrophy. They used a paramedian incision for cholecystectomy, but we operated this patient by a laparoscopic method for this large incisional hernia, and these are the port sites, and his problem is completely cured after this surgery. Follow for more.